I'm Lexi Hofferbecker. I'm a nursing student here at NTC, and this is my patient. And I'm going to wash my hands and provide privacy before I walk into the room. Then I have all my supplies gathered. So I have my IV tubing, my gloves, my stethoscope, my blood. Not yet, just my normal saline. Then I have need to identify my patient. So, hi, what is your name and date of birth? So I can see that this is Betty Jones, and I can see her date of birth is 7/19/1965. And I check over here, and both of those match up. So 05/21/1952 is the date of birth, and then Betty Jones. You tell me your name and date of birth. Thank you. And so that's correct. So I need to make sure that I explain my procedure. So today we're going to do blood administration. So I'm going to assess the patient to see if they're able to tolerate the procedure very well. And I'm going to tell you some side effects that might happen from a blood transfusion reaction, which would be side effects. That might be shortness of breath. It might be elevated temperature. So if you feel anything abnormal today, I need you to let me know, okay? So I'm going to check the patient for allergies as well to make sure that that matches up. And I don't see any allergies. My glasses are fogging up. Okay, so next I'm going to check the red armband. I can see 456654. I can see that that matches up, so we are good. And we have informed consent for this procedure. And I looked, and we have a order for a blood transfusion today. So I am going to take some lifespan considerations that might happen, which would be if this was a young adult, I would make sure, or if this was a child, I make sure to have the parent in the room use a smaller gauge needle and be more cognizant of the child might be nervous because they might have never had this happen before. So that's where a parent really comes in. And so the gauge needle that we will be using for blood transfusions, anywhere from 18 to 22 gauge. And if a blood transfusion happens, what we might want to do is, what we want to do is we want to stop the IV blood administration immediately. We want to leave in the IV. We want to clamp off the blood. We want to allow the saline to flush into the blood, into the vein, because we don't want any more of that blood. We want to stop that blood immediately. And so next, what I'm going to do is I'm going to pull back from the IV, make sure that I get some blood, check for the patency of the IV, check the IV site. I don't see redness or swelling. And so next, what I'm going to do is going to check and assess for the vital signs and for lung sounds. So all the vital signs and the lung sounds. And then what I want to do is I want to check the expiration date on my sodium chloride, which I see is not expired. Then what I'm going to do is I'm going to prime my tubing. So we might need a warmer for the blood, so we do not have that in the orders today. And so we're good on that. So I'm going to prime this tubing. Make sure the roller clamp is clamped. All right, it's clamped. Before we prime it, so now we're going to prime sodium chloride. So make sure it gets in there nice and good. then what I want to do is I want to make sure that the roller clamp is unclamped so that I can allow all of these air bubbles to come out and prime the tubing. And then I want to squeeze the drip chamber after I'm all done with the priming. So it's squeezed all the way up there to that filter. So then I'm gonna leave that there for now. And so next what I'm gonna do is I'm going to order, make sure that I get this order for the blood, and I want to check, I want to do this with the blood, make sure it's nice and mixed up, check for color, consistency, so I don't see any blood clots, I don't see any gas bubbles, and the color is red and normal. So next, I want to make sure that I get the blood within 30 minutes. I want to use the blood from pulling it out of the blood bank. And so I'm going to call the nurse, and we are going to verify that we have all of the right blood. So, I'm going to read this off to the nurse. So, med record number 224466. Med record number 224466. Location, HLRL. Location, HLRL. Account number 123456. Account number 123456. Patient name, Betty Jones. Patient name, Betty Jones. Red armband number 456654. Red armband number 456654. Then I want to check, and yep, I'm the patient. That's what it is as well. And then patient blood type, B positive. Patient blood type, B positive. Donor pool number 7890. Donor pool number 7890. Units in pool 4. Units in pool 4. I'm going to read you this because I will start with this one. The donor pool number is 9890. Donor pool donor pool number 7890. Donor pool number 7890. Units in pool 4. Units in pool 4. Volume 250 milliliters. Volume 250 milliliters. Blood component PRBC. Blood component PRBC. Expiration date 12/22/2020. Expiration date 12/22/2020. So we are good. Blood donor type O positive. Blood donor type O positive. Compatibility test completed. Compatibility test completed. So the cross match is done. The date is today's date, and then the date is today's date. So we are all set with that. So what I'm going to do is wash my hands. Then I'm going to don these gloves over my gloves. Wow, these are a lot cooler than my gloves. They're hot right now. And I got all the vitals, lung sounds. I checked the consistency on here, shake it up a little bit. Then, before I use this, what I wanted, I'm going to have my gloves on, so I'm going to stick this in here. Then going to prime my tubing. So I want to make sure that I want to wait until there's red blood that I see here. So I'm going to unclamp this and then hold this so no blood comes out because we don't want to waste blood. Then going to make sure I get all the air bubbles out of here because air bubbles do not do good when they're in veins. Alright, and now I can see some blood coming here. So what I'm going to do is I'm going to put the roller clamp on. Okay, so now what I want to do is I want to hook this up to the patient. So what I'm going to do is assess the site for redness or swelling, and then there's none, and the patient is doing well. So I'm going to take an alcohol swab, and then alcohol swab this port right here, and then for about 15 seconds and let it dry. Then going to hook this up to the patient, and then I still have my roller clamp clamped. So now what I want to do is I want to get this hooked up in the channel, and then this saline right here, you can see that it's we don't want that in combined with the blood, so I already had clamped that. And then, so I'm going to close this. And then I'm going to turn the system on. Confirm. Then we're gonna channel select. Then we have Guardrail's IV fluid. And we have red blood cells. And then we have 50. And for the first 15 minutes, we're gonna do this, and then we'll change it later on. So we have 250, so we're gonna do 225. And now, before I begin the infusion, what I want to do is unclamp my roller clamp. So now this will be going. And then this is unclamped as well. And we have this that is clamped, the normal saline. And then what we want to do is we want to start the infusion. And the infusion is going very well. So I'm going to check to make sure that there's no inflammation above the site, everything is doing good. Then I want to see how the patient tolerant procedure 15 minutes after this blood administration has gone. I'm going to take my vitals and lung sounds again, so the O2, blood pressure, heart rate, respiratory rate, and then I'm going to oxygen. Then I'm going to allow this to keep on going. And I already had said what would happen in infusion reaction, transfusion reaction. So I'm going to turn this off because we are done here. And it has already, but before I do that, what I need to do is take the sodium chloride after this is done. So I would clamp our red blood cells here that are already done, and with that I would put in the normal saline and then allow that to go through. And then I'm going to turn this off for the patient because they're all done, and every 15 to 30 minutes I would make sure to check my patient to see how they're tolerating the procedure, and check for shortness of breath, and if they are tachycardic, and if they have a elevated blood temperature, because those could be transfusion reaction symptoms, and anything abnormal we'd want to know about. So after the procedure, I would want to, now that I'm done dealing with blood, if there's any blood at the site, I'd want to clean that up, but I would put the blood in the biohazard of this blood bag, and then I would want to put all the blood IV, the IV right here, all the tubing, along with the blood in the biohazard. And then what I want to do is take off my gloves, because I'm no longer dealing with blood, and then I would put them in the garbage. And then what I would want to do would be to document my findings. So I would document the gauge needle that I used. I would document all of this information. Usually there's like a electronic thing that you'll scan as a barcode for all of that. I'd want to document the time of the beginning of the infusion, and then after the infusion was done, I'd want to, so the start time and the end time of the blood administration. And then I would want to document how the patient tolerated the procedure, and I would want to document I would want to document my name and then my date of birth, because I administered the blood, and then their name and their date of birth, and the date, and then I would want to dispose of all my supplies, which I already said, and then that would go in the biohazard, and then the tubing would go in the biohazard as well. And then what I would want to do is make sure that my patient is holding the procedure very well, doing my checks for their vitals and the lung sounds every 15 and 30 minutes. Then I would want to make sure that the patient is comfortable, so in a low lock position, and provide for safety. And then I would document the amount of volume, which is 250 milliliters, and the RH factor, and then the date, and then the patient's name, and their med record, their account number, and then I would wash my hands, and then I'm done with the procedure.